In this video, we're going to look at the mapping that we saw in Minneapolis, and this should be a pretty brief video for you to better understand it. So first off, there's two maps. Map number one is the clinical map, and map number two is the geographic map. And the way that you would use either of these is for the clinical map, you're going to want to look at this when you're thinking about diagnoses of disease, and for the hospital are clinical. You want to use the map that's for geography. This is more for us to better understand what the geography includes for a area or position. So we make it based on so let's start first with clinical. While it's loading, I'll remind you again that when we were in Minneapolis, we talked about the layers of the map and the navigation of the map. So layers over here represent what we can possibly be looking at. You should probably never use every single layer because each layer is expressing some different piece of information, and it could be very confusing for somebody who's not familiar with our work to understand what the layers actually mean. So first, I'm just going to right-click on the map and choose Reset Navigation. And the reason I'm doing that is because whatever the inputs are in tab A, whatever city or county I picked, the map doesn't know to go there until I reset it. Reset navigation. Okay, apparently what I picked was Florida. And again, this is the clinical map, and so you're seeing a lot of different data points. And again, we want to clean this up before we show it to anyone. So first, let's take away the thoracic primary care physician diagnosers. Let's take away the AAA prevalence, and let's just look at these two things, which is the AAA diagnosers that are primary cares, PCPs, and the aortic programs, which is code for hospitals that do EVAR or EVAR. You can see there's a couple of hospitals here, but that's the field. So let's uncheck the primary care physicians, and we can see, all right, there's about 8 hospitals. Next, we want to look at the diagnosers, and here we are. The shades of color represent the depth, or rather the how concentrated the diagnoses are. So in other words, the darker the color, the more AAAs are being detected. Lastly, I want to remind you of the navigation. So you're going to always have the hand being the darker shaded color. That means that you can move the map. So I'm just holding down my mouse over the map and moving it. If I want to actually collect data, then I'm going to not use the hand tool. I'm going to use the capture tool, which is this square, and I'm going to pick, for example, a lasso, and I'm going to create my own range just by using my cursor and drawing around it. And now that I've done that, the data is showing up on this side of the screen, and it's showing everybody. It's showing cardiology, internal medicine, nurse practitioners, et cetera. And it'll show you, as you scroll to the right, their diagnoses. So here we go, AAA diagnoses right here, and the name of the doctor. Now, the other thing you could do, instead of taking a giant range of data, is you could click on one circle. And when you do that, you can see that potentially that one circle is one practitioner. In this case, it is. It's a nurse practitioner named Glenda Hannon, and she has 36 AAA diagnoses. But in other instances, when you click on a dot, it may be just the address for multiple practitioners. And so we'll see, this is a good example. This is one, 2950 Cleveland, Lauderdale. And you see there's about 15 doctors here of varying specialties. This might be a clinic, it might be a hospital, I don't know, until we look into it further. But that's how you would use this map to understand where the diagnoses are and who has the. So let's move to the geographic map next. And this may take a while to load. These maps may take a little while, so give yourself some time. Again, it's showing the West Coast, but I know that our inputs are Florida. So I'm going to right-click and click Reset Navigation. And there is definitely an error. So we're not looking at Africa. Let's try this again. Okay, I just needed to change one of the layers. So I picked city, and in this case, I have Pompano Beach and Fort Lauderdale. So when we go back to my inputs, see if that's what we have selected. Pompano Beach, Fort Lauderdale, and then some of these other cities are selected as well. Okay, that's correct. The way this map looks, this is just showing you the city map of the cities we selected. There's not a whole lot of value in this unless you're just trying to show someone this is the area that we're focusing on or we're concentrating on. And of course, you could take a screenshot and put it into a report. I don't think that you'll see that much value out of the city map, maybe out of the county map, however, because with the county map, it might give you a better idea of how to approach a hospital and explain what they're trying to do as far as the market landscape, which is a different tab, and we'll talk about that in the series. Or maybe you would look at referral region. In this case, I don't think a referral region has been selected. And this would be probably used if you don't know the area at all and you want to understand what the typical migration patterns of patients are for that area. So if we go to Florida and we pick Fort Lauderdale. Okay, so if we pick Fort Lauderdale for the referral region over here on the far right side. All right, choosing that, now we have the geographic map. And actually the Fort Lauderdale market is so much bigger than that one county that we had selected before. So that might be helpful in understanding migration patterns. So in this case, you can look at both referral region, referral cities, or you can use, which is Dartmouth Health Atlas data, or you can use city and county, which is more typical because that's the U.S. Postal Service data, and it's how we look at doctors when we look at the physician data in the other tabs. Thanks very much for watching this video, and there will be more to explain other tabs.